Hi guys, this is Dicot Medical, and today we're going to be talking about the gross anatomy of the skull or gross anatomy of a bone. A bone is a tissue that comprises the skeletal system. Now that tissue is composed of different other types of tissue. Bones are important Bones are important in our everyday lives, and one of their major or most important functions is that they serve as a point of attachment for muscles to create or to enable movement. Today, we're going to be giving a general overview of bone, and then we're going to be talking about a particular bone, the skull. Before we jump into the skull, we're going to give different terminologies that are used to describe different landmarks or different points in the skull, their definitions, the reasons why, so that it will help aid your understanding in the skull. And then finally, we'll talk about the skull as a whole, the different bones that are involved in the skull, the different bones found in the skull, their clinical significances, and we end today. The bone is made up of different types of tissues, specifically 4 different types of tissues. And those tissues are compact tissue, spongy or cancellous tissue, periosteum, and then the subchondral tissue. Okay. Spongy or cancellous tissue, compact tissue, and then subchondral tissue. Now each of these tissues that comprise the bone actually serve different functions. The periosteum is the outer lining of the bone. No. Okay. Each of these tissues actually serve different functions. In the innermost part of the bone, we find the spongy or cancellous tissue. As the name describes, it actually has net-like appearance, like a sponge or cancellous tissue. It has a net-like appearance, and these holes are called trabeculae. Trabeculae is caused by died or dead cells called chondrocytes. And when these chondrocytes die, they leave off these holes for a various or a very, very important function, which is hematopoiesis. Now, these holes, they house the medullary cavity, which functions to produce the various cellular components of blood. Also, these holes are important in strength or in providing tensile strength for the bone, and also function as a shock absorber in walking or whenever your bone is being used, walking, talking, holding anything. How this works is that any pressure or any shock that gets into the core, because this spongy tissue is at the core of the bone, this spongy tissue then aids to distribute the force evenly to prevent fractures or to minimize fractures to bone. That's for spongy or cancellous tissue. Now, immediately surrounding the spongy or cancellous tissue is the compact tissue. The compact tissue, unlike the spongy tissue, doesn't have holes or doesn't have magnified holes. The compact tissue also provides strength, and it is a tough outer layer. It is the tough outer layer of the bone. Again, this spongy or cancellous tissue that contains the medullary cavity is the inner layer of the bone, while the compact tissue is the outer layer of the bone. The periosteum is a thin layer or the thin outer covering of the bone. So we go from the cancellous or the spongy tissue to the compact bone or the compact tissue, and then the periosteum which functions to line the bone. On the periosteum, you can also see, or you may also visualize, little microscopic holes. This is as a result of the function of the osteoclasts in reabsorption or breaking down of the osteocytes or of bone for bone remodeling, repair, or the strengthening of bone. Then finally, I'm going to talk about the subchondral tissue of bone. Now, the subchondral tissue of bone is found at the edges or at the edge of bone, where it is going to articulate with a different bone. This subchondral tissue is important because it aids the cartilage growth or cartilage genesis between the bones. So subchondral tissue, so we have the spongy or the cancellous tissue is the inner layer of the bone. Immediately surrounding it, or the outer layer, is the compact tissue or the compact part of the bone. Lining the compact tissue or the compound part of the bone, which is the outermost layer of the bone tissue, is called the periosteum. And then at the different edges of the bone itself, where the bone will articulate with another bone, this is called the subchondral tissue. It aids articulation, which is where the cartilage plates are located or they are formed. Now that we've discussed the different tissues found in bone or the different tissues we can see in the cross-section of a bone, we're going to talk about the functions of a bone. Very quickly, we're going to talk about a few functions of the bone. Number one function of the bone is that it functions as a point of attachment for muscles. A point of attachment for muscles. So in our last video, we discussed about the histology of muscle or histology of muscle tissue. And part of muscle tissue is also tendons or ligaments. Muscle attaches to bone via tendons and ligaments. This attachment of muscle to bone also means that bone functions in movement. Now, the function of bone in movement is not just the bone itself, but it's at the point of the joint. So a joint is a union of two or more bones. At the joint, the bones are allowed or the bones are permitted to slide on each other depending on the different types of joints, but there is a communication between the two bones that facilitates movement. There are various or there are different types of joints, and we're going to be explaining that later, but most joints permit movement to some degree or to some extent. Another function of the bone is hematopoiesis, or production of red blood cells, or production of blood. No, erythropoiesis is the production of red blood cells. Hematopoiesis is the production of blood. Bone is able to help, or bone aids in the production of blood in that it houses the medullary cavity. As I said earlier, the main purpose of the video today is that we're going to be talking about the skull. But before we talk about the skull, there are different terminologies, different names that are used to describe various marks or various landmarks on the skull. It can be very confusing to talk about the skull if you don't fully understand these terminologies, what they represent, and their clinical functions. Let's dive into our terminologies of the day. For bone, we've already discussed, or so far we've discussed about the structure, basic structure of a bone. We've spoken about the functions of a bone and every other thing you need to know before we jump into this video. So the second on our list is sutures. So a suture is a type of joint. It's a fibrous type of joint. Fibrous type of joint meaning that it is made up of fibrous connective tissue. So sutures, or the suture joints, the suture type of joint, is majorly and only found in the skull. So it is a type of fibrous joint, or it is a fibrous type of joint, meaning that it's made up of fibrous connective tissue. But there are other types of fibrous joints. So what actually separates the sutures from other types of fibrous joints? What separates the sutures from other types of fibrous joints is that the sutures is made up of dense irregular connective tissue. So that means that the fibrous connective tissue of the sutures is dense irregular connective tissue. Dense irregular type of connective tissue. As I said, some joints allow movement and others don't. The suture is a type of joint that restricts or does not allow movement between the bones that are involved in that particular joint. The different types of sutures are serrate sutures, squamous sutures, and plain sutures or planar sutures. Serrate, double R, plain, and squamous. Although there are different types of sutures, each suture, from the serrate to the squamous and to the plain, is found only and majorly in the skull. Next thing we're going to be talking about is a foramen, or what a foramen is. So a foramen is a hole or an opening. That's the basic definition of a foramen. The simple definition of a foramen is a hole or an opening. It is the beginning of a canal, meaning that a foramen or a notch actually facilitates the movement of different vessels or different substances, in this case vessels, which can be nerves, arteries or veins, or lymphatic vessels, passing through or passing around in the skull, within the skull. Okay, so an example of a foramen is the supraorbital foramen. Now, the supraorbital foramen is actually located bone-wise on the frontal bone. This is the frontal bone. We'll get into that. But it's actually located bone-wise on the frontal bone. It aids as a conduit for the passage of the supraorbital vessels because, like I said, it is an opening or a small hole for the passage of different vessels. Next thing we're going to talk about is processes. Now, a process is a protuberance or an outgrowth of a bone. I don't want to say tissue, but let's use bone. So a process is the protuberance or an outgrowth of a particular bone. It can also be called an eminence of that bone. Meaning that if I have a bone, let's say this is my bone. Let's say this is my bone. This part coming out is the protuberance or is an eminence or is a process part or is a process of the bone. A process we can find on the skull is the mastoid process or the styloid process. But for the purpose of our video today, we're going to be talking about the mastoid process. So it is a protuberance or a projection or an outgrowth from the bone. And today, we're going to be using the mastoid process as our example. Next thing we're going to talk about is the margin of a bone. The margin of a bone is the edge or the border of a bone or along the bone. In this case, we're going to use the example of the supraorbital margin. Yes, we really like supraorbital today. But we're going to be using the case of the supraorbital margin. It is the edge or the border of a bone. This is an edge around here like this. This is the supraorbital. This is the supraorbital margin. This is the supraorbital margin. And as described earlier, this would be the supraorbital foramen or notch. Foramen or notch. Great. So we said the margin is the edge or border of a bone. And our example is the supraorbital margin. Okay. The next on the list is condyle. A condyle is a circular protuberance. It's also a protuberance, but unlike processes or unlike a process, the condyle is circular. Another important thing about the condyle that distinguishes it from any natural process or any other process is that the condyle is found before or between joints. The purpose of the condyle is to enable or to ease sliding or movement of bones on each other. The condyle we're going to be using today, or the condyle we're going to be talking about today, is the occipital condyle. This is the occipital condyle. So it is a smooth or it's a circular protuberance from the occipital bone. It is also a protuberance, but it is circular and it is found on the occipital bone. Great. So the condyle, it is a circular protuberance, important in joints, and an example is the occipital condyle. Next we're going to be talking about is a joint. As I said before, a joint is the union of two or more bones. A joint is actually what facilitates movements around the body or movements of the body. Not just the bones, not just the union of the bones and muscles itself, but it also has to happen at a particular joint. Yes. So it is a union of bones. Great. So joints facilitate movements most of the time, but again, there are some certain joints that don't allow movement, such as the suture joint, which is under a classification of the fibrous joint. Concerning the body, there are different joints, the elbow joint, the knee joint. But if we're going to use an example concerning the skull, we're going to be talking about the atlanto-occipital joint. That's the joint between the atlas, that's the joint between the atlas and the occipital condyle. Remember, occipital condyle, atlanto-occipital joint. So a notch is the next thing. A notch is an indentation on a bone. It's a short or a very small U or V-shaped indentation on a bone. It looked like a part of bone or a part of the bone has been chipped out. Notches and foramens are used interchangeably most times, but I just wanted to separate this in case. A notch is an indentation in a U-shaped or a V-shaped indentation on bone. U or V-shaped indentation on bone. Since I said foramens and notches can be used interchangeably, that means our example for notch would be supraorbital notch, also where the supraorbital vessels pass through. But since vessels or since substances or vessels are passing through this particular foramen, we are tagging it as a foramen. So most of the times they are interchangeable. The next thing we're going to be talking about will be fossa. As I said earlier, muscles attach to bones at certain points. Now the certain points where muscles attach to bones are called fossa. They are tagged fossa. So fossa is the point where muscles or organs attach to bone. A fossa is just a wide band depression. It's a wide band depression which enables muscles or organs or whatever tissue to attach to it. For the skull, the example of fossa we're going to be using today will be the temporal fossa. So I said it is a depression on a bone with the purpose of muscle attachment, or in a few cases organs or different tissue attachment, and it is going to be, our example for today is going to be the temporal fossa. So far, this video has contained an introduction to the gross anatomy of a bone, explaining its functions and other important things to know about the bone. We also discussed the terminologies used in describing a bone, or the terminologies used in describing the landmarks on a particular bone, the skull. These terminologies can also be used in different types of bone, but I fashioned it especially for the skull. In our next video, we're going to be talking about the skull itself, the landmarks of the skull, the bones of the skull, and the clinical significance attached to each of these landmarks, or attached to most of these landmarks and clinical significances of the skull itself.